Hi, I'm Dawn Hayes. I'm the Breast Care Navigator at Grand Itasca. Welcome to Doc Talk. Today we're going to discuss what you need to know about breast cancer awareness by using lemons. At the end of our chat, you will know what breast cancer is, where breast cancer is in the world, who is at risk for breast cancer, and your own risk and other factors, when and how to do self-exams, including 12 things to look and feel for, why screening works, 6 tools of early detection to help save your life. So I'm a Lemonista with the Know Your Lemons Foundation. This means I've been trained as a global breast health educator to be able to help you understand what you need to know about your breast health and steps to take for early detection. I'm so happy to be here to talk with you today and that you are here. This work is important to me because as the Breast Care Navigator at Grand Itasca, I want more women to find breast cancer in its earliest stages when it's easiest to treat instead of in the late stages. I believe with regular mammograms and knowing what your normal is for your breast tissue, this will help you find breast cancers in the earlier stages. I have a lot of patients who tell me that they don't think that regular mammograms are super important for them because they don't have a family history of breast cancer. However, as we'll learn later, the majority of breast cancer cases do not have a family history, so getting your regular mammograms is super important. So let me tell you a little bit more about the charity I represent. It was started in 2014 by a woman who had 2 grandmothers and a close friend die from breast cancer. She was a designer and wanted to make it easier to understand symptoms, screening, and breast health. So she moved to London to get a PhD on the topic and has been building it ever since. It's been incredibly successful because it overcomes taboo, fear, and literacy issues. It's also super inclusive. As you'll find out today, it works for any age, any ethnicity, and any gender, and it is saving lives. The mission of the Know Your Lemons Foundation is to help women find breast cancer as early as possible. It's our vision to see fewer mothers, sisters, friends, aunts, and grandmothers die from the disease, and we do this through education. What sets us apart from other breast cancer charities is that we focus on early detection to save lives, and we do this globally, 21 languages and counting. Since 2017, we have educated nearly 1 billion people on social media. We will use social media, and if you want, an app, as part of our class today too. Today, you are part of our mission to educate the world. Thank you for being here. It's important to remember that this discussion today does not replace individual advice from a medical professional, and this is only educational in nature. So, when cells inside the breast don't grow and die as they normally do, it's cancer. A tumor is a lump of cancer cells. It kills normal cells around it, causing damage. Kind of like the lemon seed in this picture looks different than the lemon around it. If untreated, cancer can spread outside of the breast. This is a problem because we can live without a breast, but we can't live without working lungs, a liver, or brain, or bones. This is where breast cancer usually spreads to if it leaves the breast. When breast cancer leaves the breast, that's what we call stage 4. When it is stage 4, it can be treated, but it is terminal. However, when breast cancer is found at stage 1, where it is still small and has stayed together in a lump, survival rates are incredibly high. This is why knowing how to find breast cancer is so important to saving lives. So how big of a problem is breast cancer? Every year, we see 1.7 million new cases of breast cancer. So that's a big problem. 25% of people who have cancer have breast cancer. Breast cancer is by far the most common cancer in women worldwide, and it is increasing more in developing countries where most are, sadly, found in late stages. So think of a group of women you know, like a book club or your family. 1 in 8 of those women are likely to get breast cancer. This map shows how many people out of 100,000 die each year from breast cancer in each country. As you can see, there is a wide range when it comes to 5-year survival rates. It is 80 to 90% survival in high-income countries like North America, Sweden, Japan. 60% survive in middle-income countries, and 40% and lower survive in low-income countries. So what impacts this survival? Various reasons, but usually delays in reporting symptoms, not having access to screening or treatment, not recognizing a sign of breast cancer when a woman has it, doctors not knowing how to diagnose or treat the breast cancer. While our country may not have the highest death rate when it comes to breast cancer, a lot of people in our country get it. So now let's talk about your personal risk. Survival rates depend mostly on what stage the cancer is found. Because survival statistics are based on large groups of people, they cannot be used to predict exactly what will happen to an individual patient. No two patients are entirely alike. Treatment and responses to treatment can vary greatly. For example, in the USA, here's the difference in survival between stages. As you can see, if breast cancer is found in the earliest stages, 0 to 1, there is a very high survival rate of 99%, compared to the later stages, stage 4 of 22%. It's important to note that 1% of breast cancers are found in men, and so any men finding any of the symptoms that we talk about in this program should talk with their doctors right away instead of delaying. Men tend to not report their symptoms and their cancers are found at a later stage because of that. So will breast cancer be a problem for you? There are a lot of different types of risk factors. Some can be changed through decisions we make, and others we can't change, such as your age and your family history. So let's take a look at the things that can increase those risks. The two most important risk factors of breast cancer are being a woman and getting older. This slide shows some of the risk factors of breast cancer, and we're going to start at the top left and go over these factors. The first one is age. The higher your age, the higher your risk for breast cancer. The longer you're exposed to estrogen, the longer you've been exposed to the risk. And unless you know the secret to stop aging, you are at risk. And then we'll go down to estrogen. And we'll talk about periods, which increase the estrogen in the body. The more periods you've had, the more exposure you've had. Things that can reduce your periods are breastfeeding and pregnancy. Risk is lower for women who've had a baby before age 30 to 35. This is because breast cells are copied rapidly during pregnancy. The older the cells, the greater the chance of mutation, which may create more bad copies leading to breast cancer. Then we'll move on to medications. And here we talk about hormone therapy and birth control. Not all hormone therapies and birth control pills increase your risk for breast cancer, but some can. Talk to your doctor about whether the medications you are taking have a breast cancer risk associated with them. And then we'll move up to weight in the middle top there. Did you know that body fat produces estrogen? Your risk increases if you are overweight after menopause. And we'll look at some lifestyle issues here. Alcohol intake and cigarettes can increase your risk for breast cancer. And if you're not exercising regularly or being stationary for long periods of time, that can also increase your risk for breast cancer. And then moving up to the top on the right-hand side, we'll talk a little bit about dense breasts. Half of women over age 40 in the USA have dense breasts, which is more common in young and thin women. As we get older, our breasts tend to get fattier. That's not saying we don't have some 40-year-old women with quite fatty breasts and some 70-year-old women with very dense breasts, but that's just the general trend. This isn't something that you can feel, but it's revealed on your mammogram report. Dense breasts make it difficult for mammograms to see cancer. If you have dense breasts, you can talk to your doctor about additional screening options such as breast MRI. Some breasts are lumpy, which is common. The medical term is fibrocystic. This can cause breast pain, tenderness, and lumpiness, but it does not increase your risk of breast cancer. However, atypical hyperplasia, which is only found through a breast biopsy, is a buildup of abnormal cells in the breast. Over time, if atypical hyperplasia cells keep dividing and become more abnormal, they can turn into breast cancer. This is why additional screening is recommended for the women who have atypical hyperplasia. And then finally, mutated breasts. A family history of breast cancer, particularly if it's a first-degree relative, such as a mother or a sister, increases your risk because you may share a genetic mutation. However, 90 to 95% of women with breast cancer are the first in their family to have it. But talk to your doctor about genetic testing if it is a concern. You are more likely to have an abnormal breast cancer gene if you have blood relatives like grandmothers, mothers, sisters, or aunts on either your mother's or your father's side of the family who have had breast cancer before age 50. If you've had someone with both breast and ovarian cancer on the same side of the family or in a single individual. A relative with triple-negative breast cancer, which is a specific type of breast cancer that affects about 10 to 20% of patients. Other cancers in your family in addition to breast, such as prostate, melanoma, pancreatic, stomach, uterine, thyroid, colon, and/or sarcoma, women in your family with cancer in both breasts, if you are of Ashkenazi Jewish heritage, if you're African American and somebody in your family has been diagnosed with breast cancer at age 35 or younger, a man in your family who's had breast cancer, if someone has been found to have an abnormal breast cancer gene in your family, such as the BRCA genes or CHEK2, if you have had radiation in the chest before age 30 while your breasts are still developing, this can increase the risk of breast cancer due to possible mutations. Remember, if one family member has an abnormal breast cancer gene, it does not mean that all family members will have it. Individual testing is needed, as genes are different for each person. Estrogen is an important chemical hormone that helps reproductive organs and body parts, such as the breast, develop. Estrogen is produced mostly in the ovaries. After menopause, estrogen is produced in the body fat. High levels of estrogen increase your breast cancer risk. It's important to understand that having a risk for breast cancer does not mean that it will happen to you. Think of it like a raffle. If you have more tickets in the raffle, your chances to be selected are increased. However, anyone who has a ticket in the raffle can be chosen, even if they only have one ticket in the raffle. If you're still menstruating, here's how your breast changes during your menstrual cycle. Notice that the best time to check your breasts is 1 week after the first day of your period. This is when your breasts will be the least tender and lumpy. You can track your breast cycle on the Know Your Lemons app. It's available for download today. On this app, you can do an online risk assessment and calculate your screening plan. You can track your breast cycle using the graphic we used on the previous slide. You can do a self-exam audio guided with Mona Lisa explaining what to do step by step. You can learn about the 12 symptoms of breast cancer. You can learn about each breast test. You can learn about different risk factors. You can set self-exam reminders, and you can donate to the Know Your Lemons Foundation. This slide is a picture of what the risk assessment looks like on the app. So if you're interested in doing the risk assessment, it will ask you questions such as how old you are, what your breast cancer family history is, stuff like that. You can take this assessment and then bring it to your doctor and discuss what your individual screening plan should be. So, have you ever felt lumps in your breast and wondered what is normal? Let's watch a video and learn more about self-exam and screening.
Hi, I'm the mayor of Lemonland, and I'm here to help you know your lemons with my friend, Mona Lisa.
I've been checking my lemons for 500 years and have a lot to tell you. A cancerous lump is a lot like a lemon seed because it often feels hard and immovable. It can be any shape or size. This is the lump you investigate. There are two innocent lumps to know. One lump feels like a soft pea. These are your milk lobes, normal. Another lump feels like a soft bean. These are your lymph nodes, also normal. But you need to know how to feel around for these good and not so good lumps. Mayor, do your thing.
Thanks, Mona. Use your 3 middle fingers in circular or up and down motions. Use 3 levels of pressure, light, medium, then deep enough to fill your ribs. Also, fill under the nipple. You need to cover an area that includes your lymph nodes. So start in your armpit, then to your collarbone, and finally work your way down to the bottom of your ribs. Use 2 positions. 1, lay down with your arm behind your head. This flattens everything. 2, bend forward. This brings everything to the front. Finally, look for changes in front of a mirror. Move your arms up and down and turn to the side. See if the whole breast skin moves with you as you move your arms.
And look for these changes.
Because a lump is not the only sign.
Grazie, Mayor. The best time to feel around is 3 days after the end of your period, when everything is most normal. No period? Pick any day you like, consistently each month. Your risk increases with age, so stick with it. I've been checking my lemons, but it's not enough. I also get regular mammograms. Because a mammogram can find a cancerous lump before it can be felt. Just look at my hand to learn the difference. This is the average size of a lump found by accident. A lump through self-exam. A lump found with 1 mammogram. But with several mammograms to compare changes, the lump can be the smallest. If cancer is present in the breast, 8 times out of 10, a mammogram can find it. But if the results come back normal and you're still concerned about something, or if you're too young for a mammogram, ask about an ultrasound if you have a specific lump in mind, or get a new view with an MRI. But the only way to determine if it's cancer is to actually look at the cells, which is through a biopsy. Most lumps turn out to be fine, so don't panic if you need to check it out to be sure. Trust your instincts and know your options. When breast cancer is found early, survival rates are very high. Knowing that I've educated you makes me smile.
Share this app with a friend today at knowyourlemons.com.
Did you know that you should feel more than just the breast when you're doing a self-exam? Breast tissue spans from your chest to your armpit to your collarbone, where your lymph nodes are located. In this picture, the area to examine is inside the white dotted line. On this picture, the pink dots are where your lymph nodes are. This is why you feel the whole area from the armpit to the collarbone and to the bottom of your rib cage. Lymph nodes under your arm can become enlarged if breast cancer is present in your breast. The best time to check yourself with a self-exam is at the end of your period when your breasts are normal. This is because our breasts often swell during our period, which may cause tenderness or lumpiness. If you no longer have periods, then you can pick any day of the month to do your self-exam and do that every month. You can start doing a self-exam once your breasts develop. There are lots of different ways to do it, such as in the shower, sitting or laying down, or looking in the mirror. When you're laying down, you should put your hand behind your head because it will flatten everything, which makes it easier to cover more area. With your 3 middle fingers, use 3 levels of pressure, light, medium, and then deep enough to feel your ribs. Remember to feel the whole area between your armpit, collarbone, and rib cage using circular up and down motions. When you're standing, you can bow forward to change the position of the breast to bring everything into the front. This can help you feel parts of the breast in different ways compared to lying down, but you'll still follow the same technique with the light, medium, and deep touch and pressure and the up or down motions. Also, you should stand in front of a mirror and slightly twist your body from side to side to see the breast from different sides as you take turns raising your arms and putting them up on your hips. This will help you see if the whole breast skin moves with you as you move your arms. Look for symmetry between both breasts. Some things to think about when you're doing your self-exam if you find a lump is, do you feel it in your other breast in the same area? If so, it's likely a normal part of your breast. Is this a lump that comes and goes with your menstrual cycle? If so, it's likely related to the increased estrogen in your body. Always trust your instincts. If something doesn't feel right, have it looked at by your doctor and understand your options for getting answers. Our app can help you with that. So what do I look and feel for during this self-exam? We're going to go over the 12 symptoms of breast cancer. So we're going to go over them one by one, starting at the top row, left to right. That first lemon is showing a thick mass. The next one is a dimple or indentation. The next one is nipple crust. And after that is a lemon that's red or warm. Or if you have unexpected fluid and the timing can't be explained. Or if you have skin sores that don't seem to heal. And moving to the bottom left to right, if you have a bump, growing veins, a sunken nipple, new size or shape, the breast changes in size or position without explanation, or orange peel skin. It's a texture that's similar to an orange peel, which may or may not include discoloration. And a hard lump is the last signs and symptom. It's important to note that breastfeeding causes many changes which are normal. But if a symptom gets worse or stays around longer than a menstrual cycle, if one is still having a period, then it needs to be examined by a doctor. Trust your instincts. So have you ever felt lumps in your breast and wondered if it was normal? Let's watch this video and learn more about self-exam and screening.
Here are the steps for detecting breast cancer. Do your regular self-exams so that if there is a change, you can identify it. If everything seems normal and you are age 40 to 50 or over, then keep your regular mammography appointments. A mammogram can find a cancerous lump before it can be felt. But if you think you've found a change, go to your doctor. If the doctor agrees that something needs to be investigated, the next step is usually a mammogram. If the mammogram comes back fine, then go back to the beginning with self-exam. But if there seems to be something questionable on your mammogram, or if your breasts are too dense for a mammogram to be useful, or if you still feel concerned, the next step is usually an ultrasound to investigate. Sometimes a breast MRI is also needed, and recommended if you have a breast gene mutation. If the results from further testing come back normal, then return to the beginning with self-exam. But if there is still a question after additional testing, a biopsy is usually the next step. 80% of biopsies turn out to be fine, so don't panic if you need to check to be sure. The important thing is that you know your options and are informed about the steps you can take to be in charge of your breast health. This app explains each test in detail. Learn what you need to know before you go and how each test works. It's never been easier to be truly breast aware. Share this app with a friend today at knowyourlemons.com.
So as a review, if you find a lump in your self-exam, you should then talk to your doctor, who will most likely order a diagnostic mammogram and an ultrasound. And then after that, if the radiologist sees something that's concerning, they will order a breast biopsy. And so we're going to talk now about what the different tests look like. This picture shows the differences between the 4 categories of breast density as seen on a mammogram. As you can see, the more dense the breast, the more difficult it is for an x-ray to reveal calcifications or a tumor, which also show up as white spots on an x-ray. So on that 75% extremely dense breast, finding a breast cancer would be like trying to find a snowball in a snowstorm. Breast density cannot be felt. Breast density is determined by a mammogram and will usually be explained on the mammogram report. When cancer is present in the breast, 8 out of 10 times a mammogram can detect it. This picture shows the difference between a standard and a 3D mammogram. A standard mammogram takes 2 views of the breast from 2 angles. A 3D mammogram takes several images of the breast from several angles, which is combined to create an image. Both are useful tools for screening and detection, but as you can see, it's a whole lot easier to see that abnormality on the 3D mammogram than it is on the traditional mammogram. A key benefit to 3D mammograms is the recall rate is lower, meaning fewer women are called back to investigate questionable areas found on their x-ray. 3D mammography is also particularly useful to women who have dense breasts. Because it is a new tool, insurances may not cover this type of mammography. We recommend that you do contact your insurance company before your mammogram to find out if they cover it, and then make your decision from there. This picture shows how a water-filled cyst is seen on as an empty black hole on an ultrasound, revealing that no further testing is needed because cysts are normal inside the breast. It can also feel hard and immovable, similar to a cancerous lump, but it is not cancer. This picture shows what the inside of a suspicious lump looks like. An ultrasound helps to determine whether a biopsy or additional tests may be needed. When it is potentially cancer, the inside of the lump has white bits inside of it, and it's not smooth around the edges like that cyst that we just looked at looked like. When it's a harmless cyst, it just appears as an empty black hole. Unlike a mammogram, which is a flat picture of the breast from a few angles, a breast MRI creates a detailed 3-dimensional picture of the inside the breast from all angles. This image shows a large cancerous tumor in the right breast, with veins that have increased in size to supply more blood to the tumor. This test was done with a dye injected into the patient to help any potentially cancerous breast tissue show up more clearly. Thanks for helping us educate one person at a time, starting with you today. We have so many more women and men who need this important information too. Here's how you can be a part of this amazing global effort. You can take a selfie for breast cancer awareness. Tag @KnowYourLemons and follow us too. You can also volunteer with us and be a Lemonista. This picture shows one of our Lemonistas, Brenda Adoyo, teaching a group of 40 women entrepreneurs in Kenya. When Brenda taught them using the Know Your Lemons materials, it made a huge impact. 3 of them noticed they had a symptom of breast cancer and were diagnosed thanks to Brenda. You can be a Lemonista too. How to join is on the website. Thanks for joining us today at Doc Talk.